So welcome everybody. We're so glad to see so many of you today. Faculty, staff, and students, it's just great. And welcome Dr. John Pamplin back. We're so thrilled to see John again. And I get to tell you in a brief moment about what he has been up to in the time since we last saw him here at Columbia. He is currently an assistant professor and faculty fellow in the Provost Postdoctoral Fellowship in the Center for Urban Science and Progress at NYU. And he is also a Smart Cities Postdoctoral Associate in the center at NYU. As many of you know, of course, he is a graduate of our doctoral program, as well as our MPH program. And he's received numerous awards. I've just watched his awards accumulate, over the years. The FAR Award from Columbia, as well as the Epi Congress Top Student Award, and a couple years before that. And then several awards prior to that at Morehouse at the School of Medicine and Morehouse College. He has done a lot of teaching. A couple things that I thought really stood out for me in looking at his CV is that he was a co-organizer for several years of our Inclusive Classroom Initiative, as well as a couple other teaching opportunities, including in the Bard College Prison Initiative, teaching citizen science, and then numerous other teaching opportunities, not just at Bard College, but also teaching epidemiology in the Bard Prison Initiative as well, but then teaching in the Center for Urban Science and Progress, a class on structural drivers of inequitable health. Notably, and I guess one of the things that I most noticed was a number of presentations that John has given in recent years at SCR, at the Society for Epidemiologic Research, where he was also the president for 3 years, past president, president-elect, et cetera, of the SCR Student and Postdoctoral Committee. And so there's a number of great things. And, he's really already a standout scientist with a number of these awards, and has been conducting pioneering research on key topics. Racial differences in substance abuse and use, structural racism and health, which is something that he will speak about today. The Black-White Depression Paradox, which I think was your dissertation presentation, if I'm recalling correctly, which was really exciting and really well attended as well. And then I think more recently, some work on racial disparities in vaccination rates. Today, John will speak on structural racism in health, a tale of paradoxical findings and ubiquitous exposures. Gerald, do we have the power to share those slides now? Gerald?
Yes, I have them, Charlie. I'm sharing them right now.
Oh, good. Okay.
Okay, can you see that?
Yes?
Okay, I can't really see my screen, so. John, is that right?
So we see your Zoom window, but I don't see the slides.
John, you can also just forward that email to me in
Sure.
case we don't get it from, I assume the slides aren't so big.
Okay, how about now?
Perfect.
Okay.
There you go. Okay. Well, this is certainly a prime example of, was it Murphy's Law, that if something can go wrong, it will go wrong. So that's always adds a nice little adrenaline boost to things like this. So first of all, I really appreciate everyone for attending. I'm really excited to be able to give this presentation. Given some of the technical difficulties we've gone through already, I'm going to go ahead and hop in here. Just a quick background on myself, and Charlie gave me a really great introduction, and so I won't spend too much time on this. I received my BS in biology from Morehouse College, and I'm just going to plant the seed here to say that attending a historically Black college definitely had a big influence on some of my perspectives around mentoring, especially students from underrepresented groups. And so I just sorry, I got to double check. Sorry, Joe, I should have said, can you advance the slide forward? We're doing a little bit of double duty here. Great. So there's some animations here if you want to go ahead and click the next couple. And again, now we'll hold that there. So right, I attended Columbia for my master's in doctoral training. I was a pre-doctoral fellow in the PET program. From there, I transitioned to my current position. So I'm a provost postdoctoral fellow at NYU, and I really kind of spend my time in two different places there. So I'm a fellow in the Center for Urban Science and Progress, like Charlie mentioned, which is in the Tandon School of Engineering. And specifically there, I work within the Machine Learning for Good laboratory, which is directed by Dr. Daniel Neal. But I also work in the Department of Population Health, which is in the NYU Grossman School of Medicine. And through there, I'm affiliated with the Center for Opioid Epidemiology and Policy, which is directed by Dr. Magdalena Serta. And my work in these two different spaces is really comes together. So it focuses on the idea of thinking about state level opioid policies and policies that are trying to intervene on the opioid crisis. But for me, my focus is thinking about some really dramatic growing racial inequities in the opioid crisis. And so what I'm working on now is largely around novel machine learning methods that we can use to try to assess the effectiveness of these different policies, and especially as they pertain to Black overdose risk. Okay, switch to the next slide. And I'm going to put you to, yeah, go ahead. There you go, right there, that works. So, in terms of my background, I consider myself a social and psychiatric epidemiologist. I have a strong background in causal inference and thinking about racism and how it impacts health and racial health equity. My research is really all about socially and structurally produced health consequences that Black people experience as a product of being Black in the United States. And all of my work really has the same ultimate goal, which is discovering ways to intervene upon these factors to try to improve Black health and address health inequities. And for me, this all starts with recognizing that race is the product of racism and not the other way around. So my work is rooted in interrogating the impact of racism on health, as well as different strategies to intervene upon it. And throughout this talk, at times you might hear me refer to something like the effect of Black race or something along those lines. And it's just important to note that anytime I say something like that, I'm using Black race as a proxy for the racialization process that produces racism in our society. So in many ways, racism is a ubiquitous exposure. So a lot of the work that I'm doing is trying to think of ways to conceptualize racism for epidemiologic studies and evaluate the consequences of it, especially as it relates to specific manifestations of racism. And I think it's always important to give this caveat that the presence of an effect of health when we're studying racism by no means should be thought of as the barometer for whether or not we should be thinking about ways to dismantle racism or not. Okay, so next slide. And so my current research agenda exists in this broader context of studying the impact of structural racism on Black health and racial inequities. And it consists of three broad domains. Okay, great, So the first domain is studying the mental health, and in this, I'm using mental health broadly here, so including substance use, related outcomes for Black people in the United States, with the goal of more accurately understanding the true burden of mental suffering within Black communities. And so some of this includes, like Charlie mentioned, work on the depression paradox. I also have some work that's looking at suicidality among Black adolescents. And I've also done work around racial patterning and substance use, especially as it's used as a coping mechanism for racialized stressors. The second domain is studying US drug policy, both the enactment of the policies and the enforcement, and really thinking of them as manifestations of structural racism, whether that's because of racist intent or whether it's just potentially unintended racist effects. And this includes some of my work that's looking at cannabis decriminalization policies, or a suite of policy interventions that are sometimes referred to as overdose prevention policies, and more specifically studying racial barriers to the effectiveness of policy referred to as overdose good Samaritan laws. And then the last domain is the application of novel causal machine learning methods, and specifically doing so to try to identify heterogeneous treatment effects in big data. So things where we're talking about Medicaid claims data or National Vital Statistics System mortality data. And really, these methods can be customized to be used in a number of different settings, but in my work, I'm really interested in them to try to answer questions around to what extent the effects of a given policy are being distributed equally, or more importantly, equitably across different subgroups. And so my goal now is to take this training that I received kind of across these different domains and blend them into a unified, independent program of research that studies the drivers of racial health inequities, which researches potential interventions to improve Black health, and develops methods to do both of those things more effectively. Okay, and so at this point, I'm going to talk through a few examples of my past and ongoing work, and specifically, I'm going to start with some of my work in mental health. Next slide. Thank you. So over the last 40 years, nationally representative epidemiologic surveys have reported that Black people in the United States experience an equal or lower prevalence of major depression relative to white people. This finding's been seen pretty robustly across a number of different samples and different operationalizations of the disorder. This includes lifetime, past year, and past 30-day major depression. So this finding is often called the Black-white depression paradox, or some people will refer to it as the mental health paradox, because it conflicts with what many of us would expect, given that Black people experience this ubiquitous exposure to racism, and they experience socioeconomic deprivation and systemic violence. But it also conflicts with a well-known theory to explain the relationships between marginalized social status and health. Next slide. Okay, thank you. So in particular, social stress theory posits that people belonging to socially marginalized groups experience greater exposure to life stressors because of their marginalized position in society. And specifically, it suggests that this increased stress exposure results in their worse health. So under social stress theory, we would expect Black people to have greater exposure to stressors. And because of that greater exposure to stressors produced by structural and personally mediated racial discrimination, they would ultimately have a greater burden of depression. And though we've seen that Black people do score higher on major life stressor indices, we don't see that increased burden of depression. And that's, it's been plaguing our field for decades at this point. Next slide. So, despite considerable research and tests of a number of different, possible explanations for why this is the case, the drivers of the depression paradox are still unknown. And there are really important implications of this. So if these observed estimates of racial patterns in depression are valid, meaning if they're invalid, meaning they're being produced by selection issues or measurement error, confounding, any of those scenarios would mean that we're systematically underestimating the burden of depression that Black people experience, and that we should really be putting even more resources towards an already existing racial treatment disparity. But on the other hand, if these observed estimates are valid, meaning that they're produced by a true causal phenomenon in nature, it really kind of challenges our knowledge of factors that should promote risk among certain groups. And it offers a pretty strong, contradiction to social stress theory. Okay, so next slide. So a major challenge of the depression paradox literature is that, the paradox is implicitly based in social stress theory, but the causal relationships that are underpinning it, they just haven't been articulated explicitly. And that's a problem. It creates an issue for a number of reasons. So when we think of something as being paradoxical, what we're really saying is that, what we observed didn't match what we expected to see. And we can't deny the fact that our expectations, what we expect to see, it's always based on some kind of hypothesized causal structure, whether we're explicitly stating what that structure is or not. So by not explicitly stating the causal structure, it becomes really difficult to know if this explanatory mechanism that we're proposing is actually a good fit for the data. And it becomes even harder to determine if the analytic approach that we're using is actually addressing the right type of question. So when we look at the lack of success of existing studies that have tried to test the mechanistic explanations for the paradox, that lack of success might just be because we're hypothesizing a causal structure that's just inaccurate. Next slide. So to address this challenge, I developed two causal structures that could explain the observed racial patterns in depression. Now, these are important implications for the type of mechanism that we would look to explain the paradox based on what causal structure we identify. I'm not going to go into great detail about this right now, though I'm happy to discuss later if folks are interested. But in the interest of time today, I'm going to share the results of just one of these structures that I've tested, and that's the inconsistent mediator causal structure. Next slide. So, this causal structure is basically based on the same causal structure that we expect under social stress theory. Folks with Black racial group identity would experience increased life stressor exposure, which would then result in increased depression risk. However, under this causal structure, we would also see a direct effect of Black race on depression. And this direct effect would actually be protective. It would suggest that Black people under this direct mechanism would have a lower risk of depression. And another way of saying that is that independent of stressor exposure. So if we think about all of the ways in which folks might result in depression outside of these major life stressors, that Black people's risk would be lower along those paths. And importantly, this causal structure, in order for it to explain the observed patterns that we see, this direct effect would not only just have to be present, but it'd have to be of a greater magnitude than the indirect effect that goes through stressor exposure. Okay, next slide. So to test this causal structure, I use data from the National Epidemiologic Survey on Alcohol and Related Conditions 3. It's a cross-sectional study sponsored by NIAAA, nationally represented sample of adult civilians who are non-institutionalized. It's about 36,000 individuals total, but I restricted to just non-Hispanic Black and non-Hispanic white folks for the study. Depression was operationalized as past year major depressive disorder in concordance with DSM-5 diagnostic criteria. The list of 16 life stressors that I summed up and created a scale, and these were all assessed relative to the past 12 months. So whether you had any of these stressors occur in the past 12 months. And I also included gender and educational attainment as potential confounders, and that was based on a causal diagram that I created based on hypotheses. Next slide. So in terms of analyses, I estimated the total effect of Black race on past year major depressive disorder using a generalized linear model with binomial distribution and a log link. And I chose to estimate stochastic mediation effects using targeted minimum loss-based estimation. I'm happy to answer any questions about why I chose these estimates later on if folks are interested. Next slide. But ultimately, what this does is allows us to think of the stochastic indirect effect as the sum of all the paths that are mediated by life stressor exposure, and the stochastic direct effect as the sum of all the paths not mediated by life stressor exposure. Next slide. So in terms of what we were able to see, and you can go ahead 2 more times, Joe, thank you. So we see an overall reduced risk of depression for Black people relative to white people, and this is the total effect, and it's consistent with what we consistently see in different studies, different samples that look at racial patterns in depression. But when we look at the stochastic indirect effect, we see that Black people have an increased risk of depression mediated by stress exposure. This also isn't that surprising because this is the estimate that is consistent with social stress theory. This is what we'd expect to see. But when we look at the stochastic direct effect, we see that Black people again have a reduced risk of depression relative to white people, independent of their stress exposure. And the really important part here, like I mentioned before, is that the magnitude of this direct effect is greater than the magnitude of the indirect effect. So in other words, it's this indirect path, this direct path that is driving the overall relationship. Next slide. So, to kind of wrap this all up, we found results that support an inconsistent mediation causal structure for the relationships between Black racial group membership, stressor exposure, and major depression. And the reason why this is so important is because it suggests that the mechanism that would explain the presence of this depression paradox is a mechanism that would produce a lower baseline risk of depression for Black people outside of their stressor exposure. And just to give some context, virtually every mechanistic explanation for the depression paradox to date has been some form of a stressor coping mechanism. And that would be consistent with other causal structures, but not this one. And again, none of these mechanisms have found any real compelling empirical support. So this alternative causal structure might be why that is. Of course, more work is needed to replicate these findings in other samples and with longitudinal data, but they do produce some signal that we might need to identify and test possible mechanisms that would produce a lower stressor independent risk of depression among Black people. Next slide. And this is just to say that, this study is, and it's a study that I'm actually preparing to submit hopefully in the next few weeks. It's just one example of some of the work that I've been doing in race and mental health, but this is just kind of a sample of some of the other projects that I've been doing in this domain. Okay, next slide. Okay, so a good chunk of my early work has been focused on studying mental health and substance use outcomes that I believe should be racially patterned in a certain way as a way of documenting or further understanding the role of racism in the health of Black people and other people of color. But another approach to studying these issues is to focus on the exposure side. So conceptualizing specific manifestations of racism, studying their consequences. I think this approach is especially important in terms of thinking about possible interventions to reduce racial inequities. And when paired with the outcome-focused approach, it really provides a more holistic understanding of the different influences of racism on health. Next slide. So, that's what led me to begin thinking about drug policies as a manifestation of structural racism and how they have the potential to either alleviate existing inequities or exacerbate them. So one example from my work in this domain is looking at policies designed to decriminalize cannabis possession. And I'm really interested in them specifically as they relate to police use of force. So use of force generally refers to the set of police tactics that are intended to physically incapacitate, immobilize, or otherwise detain an individual into police custody. A 2018 report by the US Department of Justice documented that over 253 million people over the age of 16 reported some type of contact with the police in 2015. And of them, more than 985,000 of those encounters resulted in a threat or physical use of force. And it's probably not surprising that there are really, really important racial inequities in who is on the receiving end of these uses of force. So among encounters that were initiated by the police in that DOJ report, Black and Hispanic people were twice as likely to experience the use of force relative to white people. And being on the receiving end of use of force should never be thought of as, in a benign experience. But it's really easy to see how dire these encounters can be for some people when we pair it with the reality that in the United States, Black men have a 1 in 1,000 chance of being killed by the police. So what does cannabis policy have to do with any of this? Next slide. So two of the more common justifications that are given for police stops are suspicion of drug possession and detecting an odor of cannabis. So it stands to reason that changes to the criminal status of cannabis possession will result in changes in the frequency of these stops. And so we can think of this as, passing decriminalization or legalization of cannabis possession would result in a decreased number of arrests but it should also result in a decreased number of police stops. That decreased number of police stops, would also impact arrests, but importantly, we could also think of it as, it should have an impact on the number of use of force related occurrences and injuries. And so moreover, because of the well-documented over-policing of minoritized communities, it stands to reason that if anyone would see a benefit of fewer police interactions due to cannabis possession, it would be Black and brown people. And this would help reduce inequities, both in use of force-related injuries as well as other outcomes. And in fact, one of the more common arguments for why we should decriminalize and or legalize cannabis possession is for this potential impact on racial justice. But I think it's an open question as to whether those benefits actually manifest, especially in response to decriminalization. So we set out to test this theory. Next slide. Of course, a real big challenge in any type of work like this is trying to find reliable data to look at this type of police-based outcome. So policing data in many jurisdictions is unstandardized, or there's no clear guidance on how or when something is documented. Oftentimes that data is just not available. So for example, only 27% of police departments are currently supplying the FBI with their use of force data. And then another approach is to think about capturing use of force through emergency department medical claims, specifically looking at data for police involved injuries. And though this is one promising approach, it's really only going to get the really extreme tales of police use of force incidents. Plus, there's often no information on the law enforcement agency that was involved. So next slide. So our approach was to use something called a tactical response report. And these are documents that are produced within the Chicago Police Department that all officers are required to fill out for every applicable use of force incident, which fortunately for us is a pretty broad set of criteria that are very clearly stated. And so it includes any time that a subject is considered to be resisting, with the exception of fleeing, so with the exception of just running. It includes every incident in which a subject is injured or if they allege injury. Any use of essentially a weapon, so the pepper spray, chemical weapons, tasers, firearms, etc., or these kind of long range acoustic devices that are, I guess, basically trying to use pain to comply people. The kind of exception to when these tactical response reports are required is in these instances where force is considered to be, to not exceed what's normal for handcuffing or searching techniques. But something that's promising is that even in these normal use of force scenarios, officers are still compelled to file a report if there's an injury or an alleged injury. So for this project, we use these tactical response reports, and they were acquired originally through Freedom of Information Acts that were sent to the Chicago Police Department. And then we were able to acquire them secondhand from 2 locations. The earlier years are publicly available online by the Invisible Institute. And then the latter years for this project, we actually received through a collaboration that we have with the ACLU of Illinois. Next slide. Sorry, I should have had you advancing, but great. One more. Cool. So yeah, right here. So there have been 2 different mechanisms for cannabis decriminalization in Chicago. A prosecutorial discretion approach, where in April 2015, the Cook County State Attorney's Office announced that they would no longer file criminal charges for possession of less than 30 grams of cannabis. And then a decriminalization legislation approach. And this is represented by Illinois State Bill SB 2228. And officially, this made possession of less than or equal to 10 grams of cannabis a civil violation that's punishable by a $100 to $200 fine, as opposed to it being a criminal violation. So using negative binomial models, we investigated whether racial inequities in rates of use of force were impacted by either of these decriminalization approaches. Next slide. Okay. So just looking at use of force rates descriptively, on the x-axis is time, Y-axis is rate of use of force per 100,000. The dotted red line represents when the Cook County State's Attorney announced their prosecutorial discretion. And then the solid line represents the enactment of decriminalization legislation. And prior to prosecutorial discretion, we see really alarming disparities in the rates of use of force. Based on the eyeball test, these disparities continue after prosecutorial discretion, and in fact continue after decriminalization legislation. Really, with the exception of some strong seasonality, there doesn't seem to be much change at all in use of force rates over this period of time. Next slide. In this figure, we can see the rates of use of force by race and by decriminalization period. So prior to decriminalization, there were 40 use of force incidents per 100,000 among white people. The number became 38 after prosecutorial discretion and 30 after legislation, indicating slight to modest reductions. Among Hispanic people, there were 68 use of force incidents per 100,000 before decriminalization, approximately 69 after this prosecutorial discretion, and 62 after legislation. So maybe slight reduction, but solely driven by legislation. But of course, the really big important part here is this last chunk here in the purple. Among Black people, there were 327 use of force incidents per 100,000 before the decriminalization, before any decriminalization. That number became 353 after prosecutorial discretion and 351 after legislation, indicating a slight increase after prosecutorial discretion and really no apparent influence of legislation. So next slide. So we can then directly assess the impact of these changes in decriminalization on inequities. We see that before decriminalization, Black and Hispanic people experienced 8 times and about 2 times respectively the rate of force relative to white people. After prosecutorial discretion, it was 9.3 and again about 2 times. And after legislation, it became almost 12 times greater for Black folks and again 2 times for Hispanic folks. So not only do we not see a reduction in the disparity, we actually see a statistically significant widening of the racial gap in use of force. Next slide. So first off, Black people experience exceptionally higher rates of police force. And though these inequities in policing are well documented, the sheer magnitude of this difference is really alarming. Importantly, though the passing of decriminalization policies have been widely embraced as tools to intervene upon racial injustices in the criminal legal system, here we actually see a widening of the inequity, even after the passing of these policies. Neither decriminalization approach was able to reduce disparities. Rates may have decreased for white and Hispanic folks, but they increased for Black people. And this really illustrates that unless there's an explicit plan to ensure equity when these policies are kind of passed and thought of, even the most well-intentioned policy is prone to exacerbating inequities. And lastly, neither decriminalization approach seemed to impact the overall use of force rates. And there are two possible interpretations of this that are really important. So on one hand, it may just mean that decriminalization is not sufficient. It could be a signal that legalization is what is truly necessary to reduce use of force. But the alternative explanation is it might just speak to Chicago Police Department's policing practices specifically. So it could be that cannabis just is not a strong enough factor in Chicago's policing to dictate changes in any of its practices. So it's worth investigating to what extent these findings generalize to other jurisdictions. Next slide. Okay. So in addition to my work with cannabis decriminalization policies, I also have a number of ongoing projects that are looking at policies designed to intervene upon the opioid crisis. And in particular, I'm interested in whether or not these interventions do so equitably. But there are a number of methodological issues that make that work really challenging. So I'm going to speak a little bit now about some of my ongoing and future work that's thinking about causal machine learning methods and specifically using them as ways to try to grapple with some of these methodological issues. Next slide. So, questions of the effectiveness of opioid policies are vitally important because, there have been over 500,000 people who died of opioid overdose in the United States since 1999. And the numbers of deaths per year is still increasing. Currently, the opioid crisis is largely driven by illegally manufactured opioids. So this includes heroin. It also includes synthetic opioids like fentanyl. As of 2017, synthetic opioids were responsible for nearly double the mortality rate of prescription opioids. And really importantly for me and the work that I do, synthetic opioids have been especially harmful for the Black community. Since 2015, Black people have the highest percentage of overdose mortality attributable to synthetic opioids, and they also have the greatest increase in related mortality rates. Currently, I think it's 1.5 times that of white people. Next slide. So with that as a backdrop, it's pretty easy to understand why Black people are experiencing the greatest increases in overdose mortality relative to any other racial ethnic group. And so since 2010, Black people have experienced about 2.5 times the rate of increase of overdose mortality as compared to white people. And that number has become even more dramatic since the onset of the COVID-19 pandemic. Next slide. So a lot of my focus is on a class of policy interventions that I refer to as overdose prevention policies, or OPPs. And these are really comprised of 2 different types of policies. So overdose Good Samaritan laws, which are a set of state level policies that provide limited legal protections for individuals who are either experiencing or witnessing an overdose. And essentially what these policies do is they try to increase the likelihood that someone at the scene of an overdose will call 911 for help by removing fear of criminal legal ramifications, such as being arrested or charged for possessing like a small amount of heroin, for example. The other set of policies are these naloxone access laws. They're also state level policies, but they're designed to increase public access to naloxone, which is an opioid antagonist that if it's administered in time during an overdose, it can reverse the effects of that overdose. So the effects of Good Samaritan laws and naloxone access laws are shaped by one or more of a number of different provisions, and the enactment of these specific provisions varies quite a bit from state to state. Nonetheless, both sets of policies are capable of reducing overdose risk due to synthetic opioids and heroin, which means that they may also be especially equitable at reducing overdose mortality for Black people who, again, have a disproportionate burden of these types of opioids. And in both cases, these policies have been enacted pretty widely across the country. I think with overdose Good Samaritan laws, I think it's 46 states and DC have all passed some form of the law, and naloxone access laws, I think every state now has something in place. Nonetheless, the evidence of their effectiveness against overdose mortality is inconclusive. Next slide. And so in particular, a really large challenge to assessing the effectiveness of these policy provisions is this issue with policy co-enactment. So overdose prevention policy provisions are frequently co-enacted with one another, or at least at bare minimum, they're enacted in short succession of one another. And this creates a really large challenge for identifying the causal effect of any one given provision, especially with kind of standard causal inference approaches, because we just don't have the ability to see the observations before and after the enactment of a policy holding all else equal, because they get grouped in with these other provisions. But one thing that's kind of interesting is that even if we could see the effect of a single provision, it's not clear that information would be especially useful for policymakers right now, as they seem really committed to this idea of passing these provisions in packages. And I think that's really motivated by trying to throw everything we can at this opioid crisis. Next slide. And so that brings me to how we're currently thinking of trying to approach this issue of policy co-enactment, and it's specifically couched within this work that I that I've proposed as part of an NIH Early Career Investigator Award, and this was recently submitted. So the first step of this project is to develop hypotheses for which overdose prevention policy provisions may be most important for reducing overdose mortality for Black people. And we're going to do this by conducting a Delphi panel and basically extract hypotheses and theory and information from a team of experts in policy, in opioid policies, as well as people with relevant lived experiences. The next step, which is kind of the meat of this, at least from an analytic standpoint, is to identify the sets of OPP provisions that best predict reduced opioid overdose mortality. And we're planning to do this both overall and among Black people specifically. And so the idea here from a kind of bird's eye view, we're basically proposing to do an extension or an adaptation of a machine learning algorithm called treatment effect subset scan. And this is actually an algorithm that's developed by one of my advisors, Daniel Neal. And the idea here is we're going to use this as a way to try to grapple with some of these issues around policy co-enactment. So briefly, the idea would be that for any given index provision, we could define subpopulations in the data based on pre-enacted and co-enacted provisions. And by doing so, we can then use this algorithm to scan across the data and look for heterogeneous treatment effects of enacting that index provision across these different subpopulations. So in other words, I'm not just looking at the effectiveness of that provision, but specifically, does the effect vary based on what other provisions are enacted at the same time, as well as what other provisions may already be enacted. And in doing so, we hope to be able to identify specific sets of these provisions that may be more effective. And then importantly, because we're gonna do this really 2 times, once with the outcome defined as changes in overall overdose rates, fatal overdose rates, and then a second time for changes in Black specific fatal overdose rates. The idea here is to be able to identify whether the sets that are most impactful at reducing overdose overall are the same sets that specifically are more impactful at reducing for Black people. And by creating this taxonomy in AIM-1, we can take this, these data-driven results and compare them to these hypotheses or theory-driven taxonomies and use that as a way to have a theoretical basis for our findings. And then the last piece that we'll do here is we're going to explore the possibility of effect modification of these state level policies. And we really have a mind of thinking about local level factors here. So things like individuals' local access to harm reduction services, as well as local law enforcement practices, because we think these may have the potential to produce varied effectiveness of these policies, and could also influence effectiveness of race. And I'm happy to discuss some of the mechanisms for why that may be later if folks are interested. Next slide. Yep, next. Okay, so my goals at this point are really about developing my program of research and especially moving on into an independent investigator role. So some of my future projects include exploring drivers of heterogeneous impact of the COVID-19 pandemic on increases in fatal overdose rates, identifying potential drivers of spatial temporal suicide clusters that differ by race, and ultimately building towards an R01 proposal that's focused on intervening on some of these factors that may be responsible for the accelerating disparate rates of overdose for Black people. Another large part of my focus now is, continuing to build new collaborations. And so obviously one of the draws of this department is that there's a lot of active research here that I think has a lot of potential for really fruitful collaboration for me. So whether that's folks who are currently looking at the opioid crisis and thinking about equity in terms of the opioid crisis, folks who are thinking about different applications of machine learning approaches, especially for identifying inequities, and folks who are doing work around policing and the criminal legal system on health. And then lastly, I'm really looking to build up my research team, and a big part of that for me is thinking about the developing of students. So next slide. So as I kind of mentioned briefly earlier, something that I'm really passionate about is mentoring, and specifically based on my experience training early on at an HBCU. It's something that I think about a lot, especially when it comes to students from historically excluded backgrounds in academia. And that's something that I'm really looking forward to, having the opportunity to engage in that more rigorously. And then for me, teaching and mentorship go hand in hand. And so I'm also very passionate about teaching, as Charlie mentioned. It's something that I've spent a lot of time with up to this point in my career. And a lot of that has been focused in teaching epi methods at varying levels, and having a real strong focus on thinking of what it takes to create an inclusive and engaging classroom space. Next slide. And so just a few kind of brief examples of my teaching experience that I want to highlight. So I'm currently teaching a course that I've developed at NYU, and it's called Structural Drivers of Inequitable Health in Urban Spaces. And the course encourages students to think of city policies as structural determinants that could either alleviate or exacerbate health inequities, regardless of what domain they're from, so whether it's transportation, whether it's zoning, et cetera. There's a strong focus on this idea of thinking about different methods that we can use to try to assess not only the impacts of these policies, but their impacts for equity and health. So it's currently a course that's a part of the MS in Data Analytics program at NYU, and it's an elective. And so it's been a really great opportunity to develop it. But I will say that while I was developing the course, I kind of did so with the idea of being able to tailor it for epidemiology students and bring it with me. And that's definitely something that I could see doing here. And then lastly, just to highlight some of my experience teaching public health research methods, including Introduction to Epidemiology as part of the BARD Prison Initiative, which I think many folks here are familiar with, but it's a degree granting program through Bard College in which is operating in 6 of the correctional facilities in upstate New York. And I just highlight this because I think it's really important, for me in teaching in this program, being able to teach epi methods, but teach them to students with non-traditional backgrounds, at least as we think of them in academia. I think really thinking about how to do so and how to do so effectively needs to be a big part of how we think of inclusive classrooms moving forward into the future. Okay. And so next slide, just revisiting this here. So this kind of last space where I'm landing in my career and ready to kind of take off into this space of putting together all these different domains to kind of launch this independent research career. And then one last time, if you would, Gerald, just to acknowledge, all my collaborators, both at the NYU Center for Opioid Epidemiology and Policy, as well as the Machine Learning for Good Laboratory, my dissertation committee, and collaborators with the ACLU of Illinois, and of course my funding. All right, so that's it. Thank you very much.
Thank you, John. That was great. Despite all the different challenges, that was really, really awesome. The technical issues, but we really got a great sense of what you've been doing and what you've been up to. I'm going to let you take questions, and we do have time, so it's fantastic.
I tried.
I can start out with a question, unless you want to prioritize students. I don't know if there are students who have questions. But
yeah, we can open it up to the students first if any of them have questions, or maybe they're still thinking them up. Go ahead, Carrie. Maybe students will jump in after you.
sure. Thanks, John. That was a really lovely talk. It's really great to see, the work that you did at Columbia now merging with all this work you're doing at NYU and how this is really progressing. And in particular, it seems like the machine learning methods that you're talking about, even like kind of causal machine learning methods, there's always been this tension vis-a-vis social epidemiology because those methods are kind of seen as data-driven versus theory-driven, and sometimes they're called a-theoretical. And I know that your work has always been very rooted in kind of theory and theory-driven research. So how do you navigate that tension between the data-driven work and then the theory-driven work? How do you kind of embrace the best of both worlds?
I think that's exactly what it's about, is embracing the best of both worlds. And I think it's about acknowledging these as tools that can be useful for specific contexts. But they aren't a one size fits all solution, and they're not something you can turn to for everything. For me, this is really in the methods that the application I'm using it for is about trying to develop a signal. And it's really why the first part of this proposal is based on this idea of having this Delphi panel to create theory-based lists of, okay, what are the provisions that we expect to be most impactful overall? What are the ones that we think are specifically going to be attuned to Black overdose rates? Why do they differ? And then being able to take that information and look at the results of this data-driven approach and look for consistencies and look for inconsistencies. And especially when you see inconsistencies, being a little more cautious or a little more hesitant before running down the road with those, and thinking of that as a means for further exploration. And so I think that it's really about the idea of, yes, these are data-driven approaches, but they can be paired with hypotheses in a way to try to be able to pull something more out of them.
Thanks.
John, I think Navi's iPad has a question.
Yes, my iPad specifically has a question for you, John. That was a great talk. I was fortunate enough to hear a practice of it last week, and I'm so proud of you, John. My question is about your approach to mentoring students. Do you have a strategy for helping students develop their own research questions, and what is your approach? And I would be so fortunate to have you as a mentor myself. So I'd love to hear what you say.
So I think one of the things that I've learned the most is that you have to be able to meet students where they are. And I think one of the best things you can do is convey to students what the full list of options are. And I mean that in terms of mentoring approaches too. So I think especially for me, something that's been really important is that especially with a focus on students who aren't historically represented in these spaces, understanding that a lot of times they don't know what they don't know. I think when we think of this gap between, folks who are, who are well represented in these spaces and those who aren't, we often think about things like, okay, well, let's get them writing workshops and things like that. And there's definitely utility. Frankly, there's utility for all of us in a writing workshop. But I find that the gap that tends to be the largest when it comes to students from underrepresented backgrounds or not is not knowing things that we assume that everyone knows. And so by presenting, folks, so for example, to that question, I can tell a student that I'm training that, hey, we can do something where I have projects that are really well developed and they can, frankly, get you product. And that's something that will be valuable for you for all of these reasons. Conversely, I can help you spend time like thinking about what you want to do and really developing your ideas and really developing what you want to do, and understanding that that's going to set you up on a different path in terms of like being able to identify in terms of your own program of research, but it's not going to get you products as quickly. And understanding that each of those approaches has pros and has cons. And if you lay both of them out to the student, then they can have a conversation with you about what makes most sense for them.
I agree. Thank you so much, John.
Is anyone else? Can I ask? Were you? That was great, John. Were you surprised that decriminalization and the other policy didn't have an effect, that it increased the inequity? And I was, and what do you think explains it? I mean, I don't know. Just wondering.
So I wasn't terribly surprised, and there's a few reasons why. The first is a broad reason that I'll say that goes kind of for all policies, in my opinion. In every case of a policy, regardless of what its intent, it's being presented in a landscape that's already, where the structures in place are such that they produce inequity. We have a long-standing historical and in a different version of this talk, I have some history slides on drug enforcement policy. And so I'm happy to share those if folks want to talk about that. And so when it comes to enacting a policy of any kind, if it's agnostic to these inequities, the inertia is such that it's easy for them to further drive them as opposed to alleviate them. And so I think that's the first piece. The second piece is something that's really important to note, especially for the prosecutorial discretion approach, is that prosecutorial discretion actually, there's very little of reason for it to actually influence policing behaviors. And I think for those of us who don't have much experience in these spaces, the assumption is once the prosecutor determines that I'm not going to charge for this offense, then naturally the police should stop arresting for that offense. And in practice, that's not really what happens. There's no reinforcement for any given officer. Let's say that they make 20 arrests in a week where the charges get dropped. There's no system in place of where someone comes back and says, hey, stop making these arrests because they're not leading to charges. That system does not exist, frankly. And in fact, especially when you get into a lot of the qualitative research, you see that, there is a history of using arrests, even arrests that will not turn into any kind of charge, as a punitive factor. It's used as a harassment tactic. So the idea that a prosecutorial discretion approach wouldn't lead to this decrease doesn't particularly surprise me. The last thing I'll say is I actually have some other work that we're looking at arrests in response to both decriminalization and legalization. And this is work that I'm doing with Spruha Joshi, which I know many folks know here. And the thing that we've actually seen is that even in places that have passed legalization for cannabis possession, you see the disparity in possession arrests dip, but then the disparity in overall arrests continue to grow, because what happens is instead of possession arrests, suddenly you see a big uptick in distribution arrests for Black people. You find big upticks in other related arrests for Black people. And so again, I think there just needs to be, really the goal of this work is to suggest that even these well-meaning policies, there needs to be a much larger concerted machinery in place if we're going to see movement.
John, before I forget, I was going to ask you that exact point, because I've been talking to DAs in various cities, some very progressive DAs, and they're making that observation on the ground as well, that there's a compensatory effect that may be going on that could be driving it. You made a point about unique to Chicago in your comments as one explanation. I think it would be fascinating to also look at other cities too.
Definitely. And so we've extended this work, not in terms of use of force, because like I said, frankly, it can be really challenging to get good use of force data. And even this use of force data, I mean, I think it's light years ahead of many other jurisdictions, but it's still a within from the Chicago Police Department. So there's always going to be some concerns there. But nonetheless, yeah, I think that's one of the goals that we have, is to be able to move this into other jurisdictions as well.
And I think we can take maybe one more question, and someone had a hand up. Maybe Leslie had a hand up. So
I put a long question in the chat, which I'm not going to ask right now, but it's about an AJPH article by Haddon in February. I wondered, clearly it looks racism is driving the mechanism, which was cannabis and now is something else. And that rings true. Interesting to see what you find. But what about the earlier, like stop and frisk? Would looking at stop and frisk policies and looking at change, because does putting a spoke in the wheel, so to speak, as opposed to taking away the potential logic. I mean, I bet most of those cops smoke marijuana in Chicago. That's a clear stereotype, but what about, say, stop and frisk, which says before you stop? Do you have any sense about that, and whether that'd be a fruitful subject?
So whether, if I understand your question correctly, whether if we looked at stop and frisk as opposed to police use of force, whether we would see these kind of changes.
Yeah.
So it's certainly a worthwhile question to further investigate. I think one thing that has been noted is that stop and frisk has obviously been in the news cycle, or was a few years ago, quite a bit, especially in New York City, and the 2018 federal report that showed it to be really egregiously unconstitutional in terms of racially discriminating against Black and brown folks. Even though the number of stops in New York City has dropped by, I think maybe 2 orders of magnitude, if not just 1, the inequities have persisted. And so part of the concern here, again, is this understanding that unless there needs to be a more concerted mechanism beyond just saying, okay, well, if we make this overall policy change and it's disproportionately hitting one group, we should expect they will get most of the benefit. That's just not what we're seeing kind of across the board in these different circumstances. And so I think that one thing that I'm really curious about is that in New York City, police data is always challenging to get by We have a couple of we have a current partnership with the Mayor's Office on Criminal Justice, and we're hoping to move into this space. But especially now that New York City has passed their legalization, and especially, or I guess New York State rather, and especially the really hard fought battle to make sure that the odor of cannabis could no longer be a reason to stop folks. It'll be interesting to see whether stops in New York City change, or whether the stops maintain, but the rationale, because they are supposed to have a rationale for what motivated the stop. And so that's something we have kind of on our radar for the coming years to try to investigate.
Thank you.
Thanks for the great questions, everybody. We are a bit over time. And your reference to MockJ and the work you're doing with them and is just a sort of a window into the much bigger body of work that you've done that we're all so excited about, as you can see from all the questions you're getting. So I just wanted to thank you, John, for taking the time to be with us again today. It's just wonderful to see you and to have everyone here. Hopefully you're getting a good sense of meeting with people this past week and then upcoming. And thanks so much for taking the time, everybody. And if you have any trailing questions for John, please reach out.
Yeah, of course. Definitely feel free to email me. Happy to chat. Yeah.
Okay.
Thanks, John.
Thank you, John. Sorry about the tech snafu.
Oh, keeps you on your toes.
Yeah, you were just demonstrating your flexibility and ability to adapt. I understand now. It was all deliberate. Always thinking you are. Okay. Thanks.
John, so see you tomorrow, right?
Yep. Good. Looking forward to it, Charlie.
Okay, good. And I think you have a full meeting schedule, right?
Yep. I have a few this afternoon, and then we'll start tomorrow morning as well. So looking forward to it.
Fabulous. Thanks for all. Sorry about all the tech stuff.
I'm pretty sure it was on my end. It's funny. I restarted my computer right before this because I feel like that's the thing. You want your computer to be fresh, and apparently that was the worst move I could have made. Apparently my camera goes out, and now my computer doesn't share a screen anymore. So I should figure that out because I do have to lecture tomorrow, tomorrow evening. So I should try to make sure I can get that figured out before then.
Yeah, absolutely. But I think it went fine. It went just fine. Not all your animations worked as planned, but you adapted, which is fabulous.
Gerald, thank you so much, Gerald. I really appreciate your help.
Very welcome.
Okay. Thank you.
Bye.
Talk to you tomorrow. Okay. Bye-bye.